HHT is a relatively rare and underdiagnosed disease of blood vessels. It's inherited, hence the first H or hereditary. It can lead to bleeding, hence the second H or hemorrhagic. And it can lead to abnormal appearing blood vessels, or the T, telangiectasia. These are usually tiny little red spots that can be on the lips or the tongue or the fingertips, and they generally don't cause any trouble. But if you have an abnormal blood vessel in your nose, it can lead to frequent nosebleeds. Most children do have nosebleeds, but the type of nosebleeds you get with HHT get worse as you get older. And so it may not be obvious to most children or their parents that a nosebleed is unusual. But by the time you become 50 or 60 years old with HHT, most patients have daily nosebleeds. Sometimes they're nosebleeds all day long. Other problems with HHT include bigger vascular malformations that can happen in the lung, about 55% of adult patients, and close to that in pediatric patients with HHT will have what's called a pulmonary arteriovenous malformation. About 15 to 20% of patients will have one of those malformations in their brain or spinal cord. The complications of having these vascular malformations are that they are fragile and they can rupture and can lead to bleeding. If it happens in your lung, you can cough up blood, and that has other possible complications we'd like to avoid. If it happens in your brain, that's a stroke, and that has obvious implications that we all recognize. Symptoms of HHT may be difficult to recognize, and that's because you cannot feel whether you have a vascular malformation in your brain. You can't feel it in your lung unless it's causing problems, unless it ruptures or bleeds. Nosebleeds are common, as I already mentioned, and so that might be under-recognized as a symptom. We know that about 1 out of 5,000 people in the United States do have HHT, but many of them don't know they have HHT. So the recent data suggests that something like 80% of all the cases of HHT in the United States have yet to be diagnosed. The reason it's important to diagnose HHT is so that we, the physicians, can look for pulmonary vascular malformations, intracranial vascular malformations, and correct them, either through radiology procedures like embolization or through surgery. The risks of treating those are minimal, but need to be done by experienced hands. I've been seeing patients with HHT for over 20 years, and we have a lot of experience here. So the way we diagnose HHT, there's a set of criteria involving nosebleeds, red spots, vascular malformations, and somebody in the family who has a known diagnosis. After that, there are genetic markers that we can send for, and we can make a genetic test and a genetic diagnosis of HHT with a simple saliva test or a blood test. Like most diseases, there are patients who are mildly affected and patients who are much more severely affected. We call that variable penetrance. And it is true in HHT, certainly. But what's also true in HHT is the symptoms get worse as you get older. That's one of the reasons in pediatrics that it goes underdiagnosed. Children may not have many symptoms of it, or the symptoms they have are mistaken for something else. Oh, Timmy's got another nosebleed. He just picks his nose a lot. Timmy's short of breath when he exercises. That's probably just asthma, but that could be due to a pulmonary vascular malformation.